Check out the full episode of the Bendy Bodies podcast on your favorite podcast app.
If you're in a relationship with somebody that you really think might be a long-term relationship, I think you open with, I want to be honest, and this is what's going on. And, I hope that you help me through this. And I'm hoping that I will, come out the other side. I don't expect that I will be like this forever because I'm seeking treatment or whatever. But, I just want you to know now. And this is why, can we think about alternative forms of intimacy for the moment?
I had a woman who had horrible dyspareunia or painful penetration, and they wanted a family. And they couldn't have a family in the context with penovaginal intercourse, but they did intrauterine insemination. She went to under anesthesia. They did his sperm. While under anesthesia, they administered the semen into the uterus through the cervix, and she had a child. And that's all they wanted in the first place. At least from her point of view, that's what she wanted. So there are ways. That's the point. I think being honest and realizing that if you can find the sex detective sort of person who is familiar with money alternatives to the usual, then you can get help.
And a partner who's supportive.
Yeah, and I think the conversation with a therapist and what you said, Sue, especially at the beginning of that question, I think is really, really important. And I do want to just say, because I feel like it was mentioned a couple of times, and I just want people to know what a vestibulectomy is, because that's like an extreme treatment, right? That of course probably most people don't end up having. But I if you wouldn't mind just very quickly before we wrap up, explaining what that is and why you might do it.
My honor and privilege. So. It's basically the size of a thumb that goes around the opening to the vagina. It's not an awful lot of tissue. So the good news is if it's infiltrated with nerves and mast cells, which is the similar thing to EDS and endometriosis and IC and all these other things, it's an infiltrative mast cell problem. You can remove the tissue because there's no excess infiltration in the vaginal canal. There's no excess infiltration in the vulva. So you have this sort of cool opportunity to rid the body of the 1 million nociceptors that when you tickle, it just burns. So while it's an extreme therapy, the fact is there's no medical therapy for dealing with too many nerves and mast cells in a tissue. It's infiltrated. I mean, you either deal with it with alternative sexual events or you deal with it by removing it.
So in 2025, surgery is the only treatment for neuroproliferative, which is the excess nerves and mast cells, vestibulodynia. But it's only for that. We would not use vestibulectomy for any other disease state, at least at this time that we're aware of. So it's wonderful to have a treatment. And, obviously they have to heal postoperatively, but our patients, after they're healed, even the gynecologist can't tell they've had this removed because the tissue is so small. Yeah. And, once the pain is gone, you live the rest of your life perfectly normal. You can, deliver children, all of this. So there's no downside other than obviously you having surgery and you have to recover from surgery.
And that's a subset of people that have vestibulodynia or pain in the vestibule. This is a subset of those people that have the neuroproliferative.
30 different reasons for having pain.
Sure.
This is one of them.
Okay.
But it's highly associated with POTS and EDS and endometriosis and allergies and Raynaud's and skin conditions and asthma and sleep disorders, and you can go on and on. There's just lots of them.
We see it a lot in our practice because gynecologists are only really comfortable taking out little pieces of the vestibule in general. So there are only a few people in the United States that are really comfortable doing a complete vestibulectomy with vaginal advancement flap. So we have a lot of patients that come from all over to us.
I'm sure.
So that's why it's something we see a lot of, because if you have hormonal issues, it's more likely that your local doctor can help you with that.
Right.
If you have spine issues, you'll often come to us because most people don't understand that as well. So we're a tertiary referral center at San Diego Sexual Medicine. We're seeing people with the stuff that's too difficult to be dealt with by the local doctor, too challenging in terms of time management, in terms of knowledge, in terms of equipment, whatever it is. And so we always say we treat the zebras of sexual medicine. And when people call, they say, I have really weird stuff. I don't know if you want to see me. I say, oh, Dr. Goldstein thrives on patients with really weird stuff. The way I put it simply is if you had erectile dysfunction and Viagra would treat you, you wouldn't be coming across the country to see us. We're seeing the other people.
Check out the full Bendy Bodies podcast episode on your favorite podcast app.